Hello everyone, I am Jennifer Abel. I am tasked to discuss about opportunistic fungal infections in human.
Opportunistic fungal infection causing depthmycosis invade via the respiratory tract, alimentary tract, or intravascular devices. The primary systematic fungal pathogens include Coccidioides immitis, Histoplasma capsulatum, Blastomyces dermatitidis, and Paracoccidioides brasiliensis. Another examples are chronic mucocutaneous candidiasis, pneumocystosis, thrush, histoplasmosis, candida, cryptococcosis, neutropenia, and aspergillus. First, we have Coccidioides immitis. It is caused by the fungi Coccidioides immitis and Coccidioides posadaceae. It usually occurs as an acute benign, asymptomatic, or self-limited respiratory infection. The spectrum of disease ranges from acute pneumonia to disseminated extrapulmonary disease. It is a soil-dwelling dimorphic fungi which is inhaled as arthrochonidia or spores. The organisms lives in the soil in the mycelial phase, and when inhaled, aerosolized infections particles are inhaled into the lungs of potential hosts. Second, we have Histoplasma capsulatum. It is an infection caused by breathing in spores of a fungus often found in bread and bat droppings. People usually get in from breathing in these spores when they become airborne during demolition or cleanup projects. Third is Blastomyces dermatitidis. It is a fungal infection caused by Blastomyces dermatitidis. It presents as a pulmonary infection after the inhalation of spores, and it may be either asymptomatic or have severe life-threatening complications like acute respiratory distress syndrome. Fourth is Paracoccidioides brasiliensis. It is a progressive mycosis of the lungs, skin, mucous membranes, lymph nodes, and internal organs caused by Paracoccidioides brasiliensis. Symptoms are skin ulcers, adenitis, and pain due to the abdominal organ involvement. Fifth is chronic mucocutaneous candidiasis. It is a hereditary immunodeficiency disorder. It is persistent or recurring infection with candida due to malfunction of T cells. It causes frequent or chronic fungal infections of the mouth, scalp, skin, and nails. 6 is pneumocystosis pneumonia. It is a serious infection caused by the fungus Pneumocystosis jirovecii. Most people who get PCP have a medical conditions that weakens their immune system like HIV or AIDS, or take medicines such as corticosteroids that lower the body ability to fight germs and sickness. It can spread from person to person through the air. People can spread the disease even when they are healthy and have no symptoms. 7 is thrush. It is a fungal or yeast infection that can grow in your mouth, throat, and other parts of your body. With oral thrush or oral candidiasis, you may develop white, raised, cottage cheese-like lesions or spots on your tongue and cheeks. Thrush can quickly become irritated and cause mouth pain and redness. 8 is histoplasmosis. Histoplasmosis is a lung infection caused by breathing in histoplasma, a fungus that lives in the environment in certain parts of the United States and the world. Even though people living or traveling to these areas regularly breathe in the fungal spores, most of the time, they do not get sick. These include enlarged spleen and liver, gastrointestinal bleeding, lip and mouth ulcerations, and decreased white and red blood cells leading to bone marrow failure. 9 is Candida. Candida is a fungal infection caused by a yeast. Some species of Candida can cause infection in people. The most common is Candida albicans. Candida normally lives on skin and inside the body such as the mouth, throat, gut, and vagina without causing problems. Transmitted through direct contact with infected individuals or contaminated surfaces. 10 is Cryptococcus. Cryptococcus is an invasive fungus transmitted through the inhalation of spores and causes cryptococcosis, an infection commonly associated with immunosuppressive individuals. Patients present with fever, headache, malaise, photophobia, and neck stiffness as cryptococcal meningitis sets in. 11 is neutropenia. Neutropenia caused by impairing neutrophil production or by inducing immune destruction or rapid turnover of neutrophils. Sepsis is a particularly serious cause, neutropenia, that occurs with common childhood viral disease develops during the first 1 to 2 days of illness and may persist for 2 to 8 days. Last is Aspergillus infections to human. Aspergillosis is an infection caused by a type of mold or fungus. The illnesses resulting from aspergillosis infection usually affect the respiratory system, but their signs and severity vary greatly. The mold that triggers the illnesses, Aspergillus, is everywhere, indoors and outdoors.
Thank you for watching.